Hello, my name is Lambert Schuwirth. In this presentation, I would like to talk to you about efficiencies or inefficiencies in assessment. And I think it's an important topic because it may seem to many that there is always more demand on assessment or clinicians to undertake assessment activities and education activities. There is an old German saying, or a funny German saying, that patient care brings money, science and research brings fame and status, and education just brings work, and more education brings more work. So I think there is an onus on medical educators to help bring the best possible scientific evidence to what we're doing in education or suggesting in education, to ensure that what we're doing is demonstrably effective, to help you in making the education and the educational programs credible and defensible to all stakeholders, and lastly, but certainly not least, to make them optimally efficient. And it's about this efficiency that I want to present further. Here are a couple of things that you might consider in making the assessment more efficient. First, optimize your sampling. Optimize the limited time you have for assessment. For example, by avoiding unstructured long cases, by limiting the number of questions per case, and by optimally nesting your raters. I will explain each of these. Here are the reliabilities per hour of testing time in an oral examination. And if you look at the third column, you see that if you use the same examiner for all cases, reliability after 2 hours roughly goes up to 0.45, 0.47, and it won't go up even if you sample further for 3 or 4 hours. So basically that would be wasted time. Whereas if you take a new examiner for each case, it becomes much more, which is the standard OSCE approach to assessment. It has a very positive effect on reliability, yet having 2 examiners per station doesn't add much and is basically a waste of time. If you have so many examiners, just use more cases and not more examiners per case. Here's another example. Suppose you have 5 examiners and 5 assays, then sometimes people divvy up the load by assigning a group of students to one examiner, another group of students to a second examiner, and so on and so forth. It's much more helpful to assign an item to, or an essay to an examiner, because not only will each examiner develop a certain expertise in that item and therefore be able to mark the essay more quickly, also will the final judgment about each student have been made on the basis of the judgment of 5 examiners instead of only 1, dramatically increasing reliability with the same resources. Another way of increasing efficiency of your assessment is by collaborating or not reinventing the wheel. This is the country where I come from, the Netherlands, and down south is the place where I studied and worked, Maastricht, and we developed a thing called the progress test. The progress test is a longitudinal test of knowledge, which is held 4 times a year. All medical students sit the same test, but most importantly, it is a test with a very strict, strong quality control. Each item is reviewed by a large review panel, etc., etc. So it's very labor intensive. If I break down the costs, you will see that item production is almost 1 full-time equivalent. Item review is almost 2.5 full-time equivalent with admin support, totaling more than 3.8 full-time equivalents of time that needs to be invested in the quality and the production of the test, which is quite a lot. And then we started contributing or collaborating with other universities and jointly producing test items and jointly administering the test. And the investment per institute went down from 3.85 or 86 to 1.4, which is a dramatic decrease. Just by collaborating, you could get a lot of efficiency in your testing. Another inefficiency is that we tend to forget that writing items is not an easy task. Writing items is often defined as an ill-defined design problem. And yet we expect all people to do that once a year, for example. So if we had an organization where people would write items on a regular basis and get feedback, and they would just be stored in an item bank until they're needed, people would maintain that expertise and would be in the zone, so to speak, with item writing, rather than getting into it after a year, which is much less efficient. There are ways to increase the organization or the efficiency in the organization. First of all, by removing unnecessary formalities. Many rules and regulations are very extensive, have many guidelines, many exemptions to guidelines. Keeping it simple or deregulating is often a way of increasing the efficiency. The second thing is not to find a suitable approach for every different stream or every different group of students, but to keep uniformity as much as possible. I've already talked about staff development as a building of expertise, and expertise in every domain is associated with more efficiency. The long and complicated regulations is a thing I already alluded to. They often lead to giving students more strategies to game the system rather than fewer strategies to game the system. Deregulation, I can't stress that enough, deregulation is the most important way to increase efficiency. Keep your regulations stable. There is a tendency to make new regulations every year, which always keeps people unaware of what will be the new regulations and for which students they will count. Stay away from producing new regulations based on anecdotal incidents. I've seen many organizations where one thing happened and suddenly a new regulation had to take place. Incidental issues need to be dealt with on an incidental basis, and patterns need to be dealt with by regulations. The other thing that I often see is people believe in expensive methods, open-ended versus multiple choice, or people think that orals are better than written, or that essays are better than short answer questions. The literature actually doesn't support those opinions. Here is a summary of all the comparisons between open-ended and multiple choice questions. And what you typically see in these crossover designs is that the format is relatively unimportant in the validity of an item, and the content is of overriding importance. So what you ask is far more important than whether you use a multiple choice question or an open-ended question. That being said, some contents do not fit an open-ended or a multiple choice question well and need an open-ended question, and some formats do not actually require an open-ended question, or some contents do not actually require an open-ended question, but rather would suffice with a multiple choice question. So a principle of the form following content is far more efficient than trying to cram certain content in a particular format. Finally, there is the law of the diminishing returns. Don't overdiagnose. If you look at the left side of the slide, this would be an oral exam based on 2 structured cases with all kinds of elements per case being asked. Transfer and domain specificity basically teach us that it's better to include more cases. The right side of the slide shows that we could actually sample different phases of a consultation, for example, over different cases, and therefore get a more efficient way, a more efficient and a more reliable judgment about somebody's problem-solving ability than in the previous examples. Finally, there are a couple of general rules, general tips to increase efficiency at the program level or the organizational level of your assessment. First, there is the question you may want to ask yourself whether you really want to build up this huge assessment organization to capture the few bad apples that might be in your whole population of trainees. Basically, whether you want to create a number needed to treat problem. It would be more efficient if you were to able to harness all this information about how people are doing to build up the competency of your whole trainee group rather than focusing on finding these few bad apples. The second thing is to involve your trainees. We are often so afraid to involve our trainees in the assessment for fear of gaming and strategizing that we lose a lot of information. Students and trainees are very well able to provide peer feedback, and often even better peer feedback because they see their trainees in situations where we as supervisors don't see them. The third one is to make sure that everybody plays a role in the organization which is best aligned to their expertise. So admin tasks and logistical tasks are best done by administrative staff and logistical staff, and clinical supervision tasks and judgment tasks are best done by clinical supervisors. So it's no use if you have an organization in which clinical supervisors are performing admin tasks and administrative people are performing clinical judgment tasks. The fourth principle is that the famous KISS principle. The literature is quite clear that more complex rules, more complex regulations, more complex rubrics do not lead to better or more valid judgments and valid assessments. And finally, involve people with expertise in assessment in setting up your assessment program. We know that there are many strong opinions about education, but rarely does a strong opinion replace good content expertise. What I've tried to demonstrate is that there are ways of increasing the efficiency, that there is knowledge about increasing the efficiency, and that good education and good assessment does not always apply more resources, but sometimes a more efficient way of using resources. Thank you very much.